Hi, this is Sakib Rahman from the OrthoClips podcast series. And today I'm with Dr. Nancy N. Shipley, who's an orthopedic surgeon in Portland, Oregon. Also goes by Nancy MD at her website. And she is, of course, an orthopedic surgeon, but also a speaker or writer. And she's a host of the 6%, which is a new podcast that you may or may not have heard of on Apple Podcasts and Spotify. And today we're going to be talking about women in orthopedic surgery. Where are they? Thank you, Dr. Shipley, or should I call you Nancy MD?
You can call me Nancy for our interview. That's fine with me.
Great. So thank you again. And can you tell us, maybe to get started, how you got interested in orthopedic surgery?
Absolutely. I entered medicine in a non-traditional format. I started medical school at almost 30. So I had a little bit of a circuitous route to get back into school. And one of the pivotal moments, I think there were several touch points along the way, but one of the pivotal moments was between my first and second year. And in most schools, that's kind of the only time you get a little bit of a summer break. And during that time, I did some shadowing. I came into medical school thinking that I was going to go into family practice or internal medicine. And as you know, very quickly it became apparent to me that I was a surgical personality, that I wanted to work with my hands. And so I shadowed an orthopedic surgeon, Jamie Cayuette. He's in Southern California, still practicing, and watched some total hips and some total knees. And I was just amazed. I knew so little about orthopedics as a profession and as a specialty, but just to see the hip filleted open, here's this maximally invasive procedure. And then because I spent a couple of weeks with him, to see the same patient walk in, with a walker, of course, but walk in for their post-op appointment. Not even a week later, week or two later, I was just blown away. I was blown away by, that we could do something so maximally invasive and have somebody still walk, and that this person was hobbled beforehand, and the restoration of function. But I was also just impressed by what the human body can do to heal. And so that kind of got me interested. And when it came time for my third year rotations, I made sure that I included orthopedics on my rotations. And so it was just a week on ortho. I was rotating out at Allegheny General, and I was hooked. And one of the surgeons, very kindly, this is it, and this is like maybe one of my first weeks on surgery rotation as a third year, put a drill in my hand. We were fixing an ankle, and he said, "Did your dad ever let you play with the power tools at home?" And I was like, "Well, yeah." And he told me what to do, and I was hooked. So from that point on, I said, this is what I'm going for, and that's kind of how my journey into ortho started.
Yeah, and it's, you have these couple of memorable moments that you can point to. I mean, like the shadowing, which then led you, I guess, to tee yourself up to make sure you got ortho exposure, formally. And then I guess an attending who really, I guess, paid attention to your interest level, and you were able to, I guess, able to feed off of that. So that's a great story. And I guess a lot of people can relate to that. What do what would you say continue to be barriers for women in particular to join our field, which is very underrepresented by women, and what are the barriers for them to succeed once they are in the field?
Right. And your audience, I know, contains many orthopedic surgeons or soon to be orthopedic surgeons. And as you mentioned, I have a podcast called The 6%, and I named it such because at the time, women in practice, there are only 6% females. And so you are Right. There are very few women in the field. I think this is such a big question. It lies not only in recruitment of medical students, but I think that the barriers go far, far, far back, even to middle school. In middle school girls, that's where we see the biggest drop off of interest in STEM fields, and I think we lose women that early. And so it's a big topic. It's far reaching and it goes beyond just recruitment into orthopedics from the med school level.
That being said, at least by my recollection, women are, I think, close to 50% in medical school now. They certainly
True.
are, I think, in my school.
True.
But in orthopedics, we're not really getting them in the numbers that we would like. So, I'm in an academic program, and I
Right.
think some of our listeners are residents, and they're at some stage of their training. Have you thought what could be some steps that academic programs like ours could take that might help to increase the number of women in the field, from your own experience or what you've learned talking to others?
Right. I think that, a lot of this is not simply just public perception, but even from within medicine. I will share some of the anecdotes from my own experience when I decided I wanted to go into orthopedics. Unfortunately, I'm of the personality that if you tell me I can't do something, it's going to make me want to do it more. But in the process of just in the last couple of years, just kind of being a mentor in a different way. I'm in private practice. I have a social media presence as well. And I've had many, many women say, I'm in medical school or I want to go into medicine, I want to go into orthopedics, but somebody told me X, Y, and Z. And I think that if you hear it enough times and you're not going to say, well, I'm just going to prove them wrong, that these comments from a lot of times outside of ortho, other specialties even, or people who try to counsel you in medical school as far as um, what specialty to go into. You hear it enough times and it's going to deter somebody. And so, I think that there is a perception of, what it takes and who should be in orthopedics. And there's, the stereotypic orthopod, and I think sometimes when you don't fit that mold, individuals will be vocal about it. So I think that, part of it is us within the field dispelling myths. And I think that speaking on the various myths about orthopedics is important in a public setting and also in a setting in which we are interacting with medical students as they are trying to make a decision about their future career. One anecdote that I'll give, and this happened to me actually well after I was into practice. I was getting ready to do a total shoulder on a patient, and I learned from her that she told her endocrinologist that she was going to have a total shoulder, and of course the endocrinologist said, well, who is he? And she said, well, it's a she. And the endocrinologist questioned her and said, do you think she's going to be strong enough to actually do your shoulder right? And this is happening now, and this is happening among my medical colleagues. And I'm 10 years into practice, and so I think that there's a lot of PR work for us to do for our field
All right,
to
those are
educate.
our colleagues in other in other
Yes,
specialties, or maybe some of our own colleagues, who
true.
perpetuate that, unfortunately.
Right, right. And so I think that there are a lot of myths to dispel as far as like, do you have to be this strong weightlifter? Do you have to be an ex-athlete? Is it impossible to think about family planning if one decides to be a surgeon or an orthopedic surgeon? And then there's the other question of, for women, how much of our femininity do we have to relinquish when we become surgeons? And, my answer to that is none. And so, there are a lot of myths that we need to bust, not just as women in the field, but as men. I think that it's a job for all of us.
Yeah, I think those are important myths that that you're putting out there right now. One of the, I guess, as being in an academic program, one of the things that is talked about is, getting more women faculty members because although you, for instance, had a shadowing opportunity with someone who really got you interested, um, medical students are kind of there and some of them are not quite decided on what they're doing. And if they see somebody who they can relate to that doesn't necessarily project maybe a stereotype that they came in with, that they might think about it or give it a shot or decide to shadow as a first or second year student. I think at the academic level is one of the strategies that programs have tried to utilize to generate interest at the med student level. I don't know what your thoughts are on that, or do you agree or not, or do you think that's working? Or
I think
curious.
that's one piece of it, because it is important for us to be able to see somebody who we can envision ourselves being in 5, 10, 15 years. And so I think that's important, but that's not the only piece. I think in addition to recruiting more women into orthopedics in the academic faculty, I think it's also important to, among both the men and the women of the program, to have a good understanding and interest of good mentorship and advocacy, and allyship. I think that those are all important pieces because you can have a woman on faculty, but if she doesn't have any interest in being approachable to a medical student or a resident as far as a mentorship relationship, and they're not open to that, then it doesn't do any good. Um, and I think it's equally important for the men in the program as well who are in these attending positions to embrace it as well, and embrace it in a way that the women candidates, the women students and residents are not treated any different than the men. I have another anecdote that I would love to share, and this
Sure.
is part of that, I think, unconscious bias that, you can have somebody who believes that they treat individuals equitably, but then their unconscious behavior says otherwise. When I was a rotating medical student, I spent an entire month at a program in California, and it was great. There was a lot of trauma. I had a fantastic time. I really had a lot of great educational opportunities there. I was paired, and as many of your listeners know, you go and you're kind of paired with a team. And so, as the medical student, you might spend a lot of your time with the junior resident. And my junior resident was very nice, very kind person, and easy to work with. And um, but I think didn't really take that teaching role um, as seriously, or at least I thought. And and I was like, that's fine. Not everybody, he's a junior resident. Maybe he hasn't quite honed that skill of teaching yet. Not everyone's great at it. And, I didn't really think anything of it. And on my last day, I had an overlapping day with a brand new incoming student from somewhere else. And it was a male. And I remember the moment when we were standing there in the ER, and this is when we still had light boxes, right? We had light boxes, put some x-rays up, and immediately he beckons the new kid over and says, "Hey, come over here. Let me teach you how to read an x-ray. And this is what you look at first. This is what you look at second." And meanwhile, I'm standing there and I'm thinking, oh, so he actually does have an interest in teaching, but it spent a whole month and I learned nothing. And from this individual, or just what not no active teaching there. And so that really opened my eyes to how unconscious bias can be a thing and can really affect women or individuals of color, or and I think that's real, and I think that's where education is really important in an academic setting. I'm not in an academic setting, but at having gone through the process, I think that's where education of those kinds of biases and having people stop and check themselves and say, okay, am I actually being equitable in the mentorship that I'm offering and in the teaching that I'm offering, is going to be a big piece in both recruitment and retention.
I think that's a really good point and a really great anecdote for people to remember and maybe be introspective about, how they're interacting with, students. And it's interesting, issues like that, we sometimes see come up in recommendation letters and sort of the wording that someone may use
Hmm.
for one certain applicant versus another, the adjectives, the stuff that you see is kind of on their mind and how they're telling you this person's really good, and it's like same candidate, woman of color might be completely different,
Yeah.
just in terms of how you're saying, you're being effusive in your praise, but you're doing it in a different way, and it's interesting, and I think that, like you said, a lot of people are well intentioned, but don't really stop and think and kind of take a step back and uh, try to realize if you're really being equitable. Um, When do you think the 6% will become the 50% in orthopedics, at least?
Well, I don't know that we necessarily need to say, hey, it's got to be 50-50. I think if we can make progress to the point where we are recruiting more women into orthopedics, and that the environment that they step into is equitable, then it doesn't really matter where that number falls, and I think it's not just a matter of having the training program recruit and treat women equally. I think that there's, just the greater, broader, big societal project of making sure that women stay in the field once they leave your program, and that they land in a place, whether it is academic, research, private practice, whatever, where they continue to thrive. Because there are going to be brilliant candidates that come through your program and fantastic surgeons who are women who will take their first job somewhere else, and it will be a wake up call. I will say that I myself have been very fortunate in where I landed and in private practice, and I feel like I have done well and I have been happy, but I cannot tell you just the number of women who I've spoken to, my women colleagues in orthopedics, that have had an opposite story, and it's pretty tragic, and it's really sad.
Well, I think we're going to probably wrap it up there, but I want to sort of put in a plug for your podcast too, because if anyone's interested in our topic today and want to hear more about the topic and maybe hear more from Dr. Shipley, check out nancymd.com, or the 6% with Nancy MD podcast. Terrific interviews. She goes in a lot of depth with speakers. I would say with guests, I'm sorry, from many fields in which women are underrepresented. Um, Very slick production, a lot better than mine. Do you want to just give a quick plug or something for our
Sure.
listeners before we finish?
Sure thing. And as you mentioned, the 6% with Nancy MD is my podcast. It's just been my passion project over the last year, and I think that women in male dominated fields have interesting parallel paths, even when we have disparate fields of disparate career fields, I will say. And so this can be found on Apple, Spotify, just about any platform where you can listen to a podcast. You can find all the episodes also on my website, nancymd.com. Thank you so much.
Thanks, Dr. Shipley. It's been a pleasure.